The way the eye works is that light comes in from the outside world through the cornea. Then it travels through the iris, pupil, and lens. All of that apparatus focuses light on the retina. The retina is the inside lining of the eye. It converts light into electrical signals. The signals travel in nerves across the surface of the retina and down the optic nerve, and through the optic nerve to the back of the brain where it's perceived as vision. The space between the lens and the retina is full of a clear jello-like substance called vitreous. The vitreous is the scaffolding on which our retina forms before we're born. When we're young, it's solid, like cold gelatin. As we get a little experience in life, the vitreous begins to liquefy. That liquefaction begins in the middle of the vitreous cavity and spreads until all that's left of the vitreous is a thin crust or skin stuck against the retina. At some point during adult life, that skin or crust pulls away from the retina. When this occurs, it usually doesn't cause any problem, except that it picks up a little bit of an imprint from the optic nerve and the blood vessels, and so many times the person will see some little opacities in the vision that we call floaters. In some cases, as the vitreous pulls away from the retina, it will tear a hole in the retina. That can allow fluid to get behind the retina and separate the retina from the eye wall. This is called a retinal detachment. This is a very serious condition which requires surgical treatment usually in order to avoid blindness. If we catch a retinal tear before it turns into a retinal detachment, sometimes we can treat it with laser or freezing treatment to stop it from becoming a retinal detachment. Another thing that can happen as the vitreous pulls away from the retina is it can irritate the retina, specifically the center part of the retina called the macula. Scar tissue can form, and that can distort the retina and make the image then that gets sent back to the brain distorted. We often call this an epiretinal membrane or macular pucker. Another thing that can happen as the vitreous separates is it can tear a hole in the center part of the retina. This is called a macular hole. Both macular hole and macular pucker require surgical treatment.